Okay, welcome everyone. See everybody folding in. It's a pleasure to be presenting another session at TMF Week 2022. We've got a great session planned today. The session is titled "Your CRO has the TMF, don't be scared." I'm gonna wait a few minutes and allow everybody to fold in from the last session, from the networking breaks. So we'll give everything a few minutes to fold in. Now, there is today an interactive presentation. There are some polls that we're going to be throwing at you guys. So if you, right next to the chat and the Q&A tab, you'll see a poll section. That's where we're going to start to ask polls as we go through today's presentation. So we'll ask you guys to navigate there when the time is right. Again, we'll give everybody a few minutes to join. We're on the hour, 11 a.m. Eastern, or wherever that is, whatever time that is where you guys are in the world. And I'll just add my screen. All right. So just to kick things off today, I want to welcome you guys to another TMF Week session. We've got over 1,600 people registered for TMF Week 2022, which is incredible. Thank you everyone for supporting the event again for its third year in a row. Largest convergence of TMF professionals on the planet, which is really, really cool. As usual, as you've been attending sessions before, let us know in the chat where you guys are watching from today. Would love to know where everyone's coming in from. Numbers are good there, which is good. So as I mentioned, today's session is going to be focused on a really, really hot topic, an important topic that I think is addressed quite often at conferences, but I think today's presentation is going to be quite different from your traditional CRO vendor presentation. So the session is "Your CRO has the TMF, don't be scared." We're going to be here for about 45 minutes. The presentation will take roughly around 30 minutes, and then we'll have 15 minutes for questions. You can, of course, add questions throughout today's session. There is a Q&A tab. There's sort of two little speech bubbles with a question mark. If you head over there, you can start to ask questions, and we will tackle those at the end of today's session. Just a little bit of housekeeping for everyone. All of the sessions at TMF Week will be recorded and available at the end of today. So you'll be able to go back to the agenda, navigate to a session that happened prior, and go through and view the recording. Everyone that's attending today will receive a certificate of attendance for the entire TMF Week conference, not per session. So if you attend one session or 10 sessions, you will receive a certificate of attendance. As I mentioned, this is an interactive session, so ask questions. There is networking breaks throughout today. Right after today's session, we have another session back to back, but then there is a lunch break, a lunch Eastern break, I should say. And that you can head over to the lounge and chat with folks over there in the lounge. So today's speakers, joined by two amazing expert speakers, one from the CRO perspective and one from the sponsor perspective. We have JP Michelli, Director of Document Management at Advanced Clinical. JP is responsible for CRO and FFP TMF activities. JP oversees all TMF staff, project management, business development, and budgeting, TMF migrations, implementations, system development, and acts as the eTMF administrator and owner. So he's busy. For those of you that know JP, he's a busy guy. JP is a longtime member of the TMF reference model and has served on the Change Control Board and as the Zone Team Liaison, and currently sits on the steering committee. Then our second speaker today is Lila Ponce, Senior Manager, Regional Clinical Trial Operations. Lila is a clinical operations professional with over 20 years progressive experience spanning oncology clinical research, trial management, clinical SOP writing, electronic trial master file, TMF management, vendor oversight, and management of validated clinical systems. Expertise in people management and development, and creating processes governing TMF health inspection readiness. Strong communication and interpersonal skills, specifically leading cross-functional teams to decisions in process improvement, scalability, and management of validated clinical systems. So obviously, I want to welcome both to today's presentation. And with that, I will hand it over to our esteemed.
I don't know where JP is. My time is valuable. I can't wait all day for him.
Yes, we have everything with the TMF under control. My team and I are working very hard and get everything done on time. Okay, I have to let you go because I'm a little late for another call. Yeah, don't worry. Everything will be okay. I promise. Remember, you're my favorite sponsor to work with. All right, I'll talk to you later. Oh, Lila, my favorite sponsor. Sorry, I'm a little late.
A little late? You are 27 minutes late to a 30-minute call.
Don't worry. 3 minutes is plenty of time to talk about everything with the TMF.
Okay. Well, there's a few things we should talk about before we can consider this project closed. First, was the final review done?
Absolutely was.
And what percentage of the documents were reviewed?
Well, I was really hoping you would ask me that because seeing how I live here in Las Vegas, which you know is the gambling capital of the world, full of risks and chances being taken everywhere, I came up with a really fun way to determine this. So, are you familiar with the game of roulette?
Somewhat, yes.
All right, so it's really simple. There are numbers 1 to 36 on the roulette wheel, plus a 0, sometimes even a double 0. So you just pick a number to bet on. If the number hits, you get paid on your bet. So whenever I have a review coming up and need to determine the percentage, I just go and play a quick game of roulette. Whatever number comes up, that's the percentage of the review.
What?
I'm telling you, it is so much fun. So for example, if the number 20 comes up on the roulette wheel, we do a 20% review. If 5 comes up, it's a 5% review. Make sense?
Well, then tell me what happens if a 0 comes up?
Well, I mean, I think that's pretty self-explanatory, Lila. And you don't even want to know what happens if double 0 comes up. Nope.
Anyways, because we don't have much time now, since you apparently leave the fate of your TMF in the chances of a roulette game, have you exported the TMF?
We have exported it right onto a USB, just as you requested.
And is it password protected?
I believe so, but I gotta find that password for you.
Okay, has it been shipped already?
Yes, but the local FedEx office was already closed when I went to ship it. So I walked down to the end of my street and just dropped the USB in the mailbox. It'll be picked up right away in the morning. So you have nothing to worry about.
Wait. So you don't even have a tracking number?
I don't know. Do mailboxes have tracking numbers? I'll try and find out for you.
JP, listen to me, man.
Look, this has been great, Lila, but I'm pretty sure it's been 3 minutes. I really have to jump over to another sponsor call. And this other sponsor I'm going to talk to next, look, they are so picky and demanding. I'm so thankful you're not like that. You're always so understanding and willing to work together with me. Hey, just make sure you lock us in for future studies, all right? Talk to you again soon. Well, hi, everyone. Hopefully you have never been through a situation as extreme as the little fun skit that Lila and I wanted to kind of kick things off with for a little bit of fun as part of our presentation today. Hopefully over the next 20 to 25 minutes or so, we'll be able to give you some really good content and insight into how to best manage your CRO and sponsor relationship. So I am going to share our slides and get into the agenda. All right. So is that showing up as full screen? There we go. Lila, does that look okay?
Yes.
Perfect. So we're going to get things started off with vendor selection, and Lila will take that. And then we're going to walk through kickoff meeting and the expectations for the TMF related to that, TMF health check, oversight, archival, and then some key takeaways at the end, followed by another fun little skit to see if Lila and JP's CRO sponsor relationship has changed based off of the first skit from all of the content that we've presented. Before we get into the agenda though, we do have a couple of poll questions for the audience that would like to kick off. So I'm going to go to the first poll question, and Oliver, I'm gonna turn that over to you to get this started.
Absolutely. Thanks so much, JP. And what an opening skit that was. I just got to give you guys a round of applause because that was phenomenal. I'm going to launch the poll right now. If you guys want to head to the right-hand side of your screen, there's a little poll icon. And it's just below the Q&A section. And the question is, how is your TMF currently set up? Is it a CRO-owned TMF? Is it a sponsor-owned TMF? Is it somewhat of a hybrid where we have, some sponsor documentation at one area and then a CRO TMF somewhere else, or are you just not aware of what the situation is? So we've got two answers neck and neck, or three answers neck and neck now. It looks like so far CRO owns TMF. Oh, and as I'm saying it, hybrid takes the lead. We'll give everybody a few more seconds to answer. We'll give everyone, let's say, another 10 seconds. If you guys don't know where to find it, it's on the right-hand side below the Q&A button. There's a little poll section there. All right, 3, 2, 1. Poll ended. So right at the last minute, CRO owns TMF is the most selected option, hybrid at 35.6%. And then sponsor on TMF 20%. What do you think of that, JP and Lila?
I want to know the names of the 5% of the people who currently don't know how their TMF is currently set up. So,
yeah.
No, I think this is pretty standard, I would say. I mean, I thought maybe the sponsor number would come in slightly higher, but this isn't completely unexpected.
Yeah, and I'm assuming that you're going to get to the changes in trends and models as you go through this presentation. So I'll close this poll for today, and we'll have one more poll coming up in a little bit. But thanks so much, everyone, for answering. And JP and Lila, I'll hand it back to you guys.
All right. So actually, the next poll question is coming up next, Oliver. So don't go away too quickly.
Okay, and I'm back, guys. I'm back. Sponsors, do you have a company-specific TMF plan? I'm going to publish that poll. Again, it's in the same area that you were just in as you answered the poll previously. I'm interested to see here, JP, how many of that 5% that don't know how their TMF is set up if they have a company-specific TMF plan.
It looks like we're going to see a high percentage, yeah.
Yeah, well, that's good news. I will give everyone a few more seconds. It looks, yeah, so it looks like the sponsor TMF plan is in place at most organizations, 89, 90%.
Yeah, that's definitely reassuring to see, and I was expecting a high number there. Maybe even that's a little higher than what I would have expected, but it's good to see almost 90% of sponsors having a TMF plan template in place.
All right, excellent. Back to you guys.
Awesome. Thank you, Oliver. So I'm actually going to turn it over to Lila now to get us started on vendor selection.
Thank you, JP. So during vendor selection, we do try to take a look at the TMF systems involved, any TMF services that the CRO provides, or if you're taking that in-house, how are you staffed as a sponsor? And then we look at high-level sponsor and CRO expectations. We go through prerequisites. So sponsor assumptions are that the eTMF are either with your CRO or they're within the sponsor. Level setting. These are high-level sponsor and CRO expectations. If the CRO provides the TMF management services, what are their document processing expectations? Their periodic reviews, how frequently do those happen? And what is their definition of always inspection ready? And we kind of talk about planning during this vendor selection portion as well. The high-level TMF cycle, that first eTMF health snapshot, what does ongoing monitoring look like or oversight? And then in the end, archival. Now that we've selected a vendor, we'll collaborate with the vendor to plan for the kickoff meeting. And next, JP will dig into what happens during that meeting. Next slide. JP, are you on mute?
I think JP's trying to unmute himself.
Okay.
I'm guessing.
Is that better?
Yes.
Yeah.
Okay, sorry about that. There's two buttons to unmute myself, and I was picking the wrong one. So moving on to the kickoff meeting. So here there are a few things that are really important, starting off with systems overview, leading to a quality commitment, and finally accountability. And all of these things will lead to what the ultimate end goal is, which is achieving that state of inspection readiness. So when we talk about the systems overview, we're really starting to establish that trust, build a culture of quality between the CRO and the sponsor, get into things like the eTMF training, and where else is the TMF documents being stored? So are there other auditable repositories, source documents, other systems of record that may not just be limited to the actual eTMF system? When it comes to quality, there are a number of really important things that come into this component to talk about. We mentioned the TMF plan during the poll, and this is critical to really define the quality expectations in a level of detail that needs to be maintained and met throughout the entire course of the study. Whose system governs the TMF management? Do all of the contributors understand exactly how to use the system and what their role is in maintaining the TMF? How are oversight activities performed? How often, and who's responsible for doing that? And what is the level of risk tolerance that determines the health of the TMF? So there really has to be a commitment to quality from all parties in here. Otherwise, getting to that point of inspection readiness is going to be really difficult to achieve. And it really does, have a good place to start with the TMF plan, because all of that can be documented there. And then, of course, throughout all of this, there's a certain level of accountability that needs to be maintained and achieved throughout the life cycle of the TMF. So obviously there's proactive maintenance that should be going on. Who's accountable for ensuring the documents are uploaded in a timely manner and they meet your standard GDP guidelines, Alcoa C standards, etc., both prior to uploading the document, but then making sure they still meet that afterwards through regular checks and periodic QC reviews. Who's tracking completeness? If there are any gaps or issues when it comes to completeness, is there an escalation pathway to try and reconcile and resolve those issues that have been found? And one of the ways that is really helpful in doing this is having governance meetings, which can be annually, they can be biannually, but really this is a high-level meeting to really look at the overall state of the TMF and the project in general, to see how things are going, what the current status is, and to keep all of the necessary stakeholders updated and informed on what's going on, especially your leadership team members and other functional area leaders that may not be involved in the general day-to-day activities of managing the TMF, but they still, play a role in the overall management of it. So again, the kickoff meeting is really critical, both from the CRO and sponsor perspective, to talk about all these things, make sure they're in place before the active management of the TMF begins. And so I'm going to turn it back over to Lila now to talk about the eTMF initial health checks.
So now that we've had the kickoff meeting and we've kind of gone through our maybe first site active, we'll do that initial health check. And these are the expectations that were set in the TMF plan related to quality, timeliness, completeness, and end user performance. The sponsor or CRO TMF monitoring includes all of these factors. And what we want to ask is completeness tracking accurate, and is it using a risk-based approach? We don't want to track everything, but we want to track what's critical, what's important. If a trend has been identified, has retraining occurred, or are we planning to retrain each other as a group, or the vendor, or the sponsor? And as part of this ongoing retraining and checks, when trends are identified and we need to train our team members, what type of training do we provide? Hosting office hours, retraining on slides that were already that were initially trained on? What works best for each of the teams? And this first check typically happens at an agreed upon milestone, such as first site active, first patient in. It just depends on the study. Is it global? But these are all things, again, that are established during that kickoff meeting and are documented within your TMF plan. These types of health checks are conducted throughout the study. And as JP mentioned, these are the types of ways that we're able to provide our leadership with high-level overviews of eTMF health across the program. Now that we've established what we're measuring, I'll pass it back to JP to provide additional high-level activities related to oversight.
Thank you, Lila. So, of course, oversight is really important. And as the graphic demonstrates here, yes, we really are all in this together. The CRO absolutely should care about the status of your TMF as much as you do from the sponsor side. And in order to do that, there are several ways to track and maintain oversight during the course of the TMF. So obviously one of them is performance metrics. And as is the case with pretty much every eTMF system right now, you should have the ability to provide real-time metrics across a number of key data points, including completeness, quality, accuracy, productivity, and efficiency. And this is extremely important because it really is kind of the heart and soul of all of the activity that's going on within your eTMF system. But it's not just tracking this, but it's also reporting and communicating this out. Again, during regular project team meetings or the governance type meetings that was mentioned a couple of slides ago, and making sure that key stakeholders are kept aware of this as needed as well. Leveraging your CRO. So I think this is a point that actually goes a little bit overlooked sometimes, but from my own personal experience, spending the majority of my career on the sponsor side and now spending the last 3 to 4 years on the CRO side, it really does make a big difference from the CRO side, working with so many different sponsors, because we do gather a lot of lessons learned and create a lot of best practices from all of those experiences. And so being able to kind of take in and obtain all of that knowledge really helps us in terms of the way we help the sponsor manage the TMF. And so don't overlook this fact. It's the CRO does have a lot of experience working with different systems, processes, and sponsors, and can be really helpful in trying to map out the best way to oversee the TMF for your studies. And last but certainly not least, the governance meetings. Again, going to bring this up because leadership support is absolutely critical to maintaining a good status and inspection readiness of the TMF. Speaking to metrics, like I mentioned, and not only just the metrics themselves, but how does that impact the business? Like, what do the metrics really mean when you're looking at them? All of this at the end of the day should result in a really good building of a relationship between both the CRO and the sponsor. So all of this here really just points to ways to provide an expected level of oversight for your TMF throughout the trial. And I'm going to pass it back over to Lila to start off some topics about archival and end of study activities.
Thanks, JP. You know, as JP and I were preparing this presentation, I learned a lot from him. And one of those things that I learned was about archival and options for archival. From the CGen side, we typically host the TMF, and we do have some hybrid models. So this was a new area for me as far as thinking about additional options for sponsors that are fully outsourcing their trials. So typically there is a transfer, and there are several ways to do this transfer. And as far as archival goes, I'm going to let JP take this one, because this is the part that I learned a lot about different options.
Yeah, so thanks, Lila. And, you know, again, making that move from the sponsor to the CRO side honestly helped me learn a lot more about the options available for TMF transfer and archival. And so the piece that I'm going to just provide a little bit of insight into now when it comes to archival may come as a little bit of a surprise to some people, but honestly, it's not, you know, that recommended that your CRO is the one who's actually archiving your TMF for long-term storage purposes. Not to say that it's not possible, because it certainly is, but it may not be the best option. CROs are not typically built for long-term storage archival options, because it does introduce a lot of risk into the CRO organization. If there's a future inspection or submission down the line and the study has been closed for some time, then it really just heightens the level of risk for the CRO at that point. So as Lila mentioned, there's typically a transfer that takes place, which can happen in a number of different formats, which we'll also talk about on our upcoming skit. But really, you know, from the CRO's perspective, we really still want to ensure the integrity of the TMF, even while it's in the process of leaving our hands. So the CRO should be helpful to you as a sponsor in terms of trying to determine what your best option is for long-term storage of the TMF. So whether that be an internal platform that you already have available and how it's going to arrive there, or is it connecting you with another third-party vendor who might be better specialized in the area of archival of eTMFs. So again, the partnership doesn't necessarily end right away at the end of the study as soon as things are done and basically just wiping your hands free of it. Because no, we still want to ensure from the CRO perspective that, you know, everything ends up where it needs to be for its final destination in terms of the complete TMF and helping the sponsor get to that point. Anything else you'd like to add to that, Lila?
Nope, you covered it, JP.
Great. So I can see we're getting close to time here and we're right on time. So I'm going to just speak for a minute or two about some key takeaways. Three main things we really wanted to highlight here, which was spoken to at various points throughout the presentation. First off is that shared quality, you know, and that culture to maintain that throughout the study. This is really important. I can't understate this enough, because in order to get to that point of where you have a final complete TMF with no issues and everything is accurate and compliant with all of the standard guidelines and regulations, you really do need to achieve and then maintain that shared culture of quality throughout the entire life cycle of the TMF. And that starts at the very beginning, as we mentioned, from, you know, vendor selection to kickoff meeting and all of the regular meetings between that. And from both the CRO and the sponsor perspective, this again is a shared culture that should be maintained. Expectations, again, establishing that at the beginning while you're going through those kickoff meetings and processes to get things up and running, TMF plan development, etc. Establishing all of that up front and also defining what metrics and KPIs are meaningful to both you as a sponsor, but also to the CRO. As a CRO, we do maintain numerous amounts of internal metrics and KPIs, which are shared with the sponsor, but We always work to determine which ones are the most meaningful to provide that level of oversight throughout the trial. And then certainly not last, but leadership support for continued maturity in relationship. Maintaining that support throughout the course of the TMF life cycle, holding those governance meetings to keep everyone informed and up to date on how things are going, what the current status and completeness looks like. Are there any issues that require escalation, and what the pathways to achieve compliance are? Again, with the ultimate goal of getting to a state of inspection readiness throughout the entire life cycle of the TMF. So those are the 3 key takeaways. So I'm going to stop sharing my screen, and we're going to take a look back and see how things might have changed from our original skit, now knowing all of the helpful content that we just talked about. And let's see how things go now.
JP, you're on time.
Of course I am. It's so exciting that we're wrapping up this project. It's been such an amazing journey working together with you.
Agreed 100%. Before we wrap things up, I just want to confirm a few things with you. First, was the final review performed?
Yes, 100% final review of all content, just as it was defined in the TMF plan. No issues were discovered, which was exactly what we should have been expecting at this point of the project. So everything looks good.
Excellent. And so you should be preparing for the transfer and shipment now. We need to ensure that the USB is encrypted and shipped securely. Is everything okay?
Yeah, sorry. Everything's totally okay. It's just that this guy won't stop calling me, but this is my time with you and only you, so he has to wait.
Okay, perfect.
So back to the transfer. Your TMF manager actually connected me with one of your IT specialists, and we received access to your FTP, so we sent the final eTMF over electronically. Verified and confirmed all the record counts pre and post transfer, and everything went really smoothly. So now you don't even have to worry about what you're going to do with that USB afterwards.
Wow. I don't know what to say. I am truly impressed.
No need to thank me, Lila. Really just want to ensure the integrity of your eTMF and make sure you receive it as securely and quickly as possible.
Well, I do need to run, but it has been a pleasure working with you on this study. We have some additional studies starting up this year, and I think it would be great to partner up on TMF management again.
You know what? I agree 100%. You can call me anytime. We'll be here for you whenever you need us. So take care. Have a great day, Lila.
Thanks, JP. Bye.
Oh, man, this guy. Hello?
JP, my man, how you doing?
Oliver, you know, I love you, man, but you really need to stop calling me so much. If this keeps up like this, I'm going to have to start expensing my mobile phone bills to you guys.
Whatever you want, JP, just send me the invoice. I'm there. I just need you to get into some more TMF week sessions this week. What do you say?
Look, I just wrapped up a session, and I'll be participating in the TMF Fireside Chat on Thursday. You know, I do have a day job too. What more do you expect from me?
I just need you in 1 or 2. Can we get 1 or 2 on the books?
You know, tell you what, sign me up for TMF Week 2023. Instead of doing a session on CRO sponsor relationships, I think it'll be good if I host a presentation on CRO and sponsor relationships with vendors. How's that sound? Look, I gotta go. I got a whole bunch of sponsor TMFs to go save. I'm out of time, so I'll talk to you later, my friend. Bye. Thanks, Oliver, for being a good sport. The end.
Well, that was fun.
Yes, it was a lot of fun. Thank you, Lila. Thank you, Oliver.
Let's jump into some Q&A. If we can all get ourselves as excited for Q&A after that skit. I got a couple questions here, or quite a few questions actually. So let's start with what are some meaningful metrics or KPIs? You know, you talked a little bit about, you know, really making sure that you have that agreement between, you know, sponsor and the CRO. Can you give some examples of some of those meaningful metrics? I wonder who wants to take that.
I can start with that.
Oh.
You go first, Layla.
I'll go first. We talk about quality, timeliness, completeness, and performance. And we don't necessarily talk about performance a lot. So I'll start with that one as the first example. With performance, we do tie that in with quality, and we're able to bucket, if you will, our dashboards by vendor. So if for example, we have 2 vendors in our sponsor TMF, we're able to split them out for vendor 1, vendor 2, and internal staff. We look at a 5% or 10% threshold for quality issues for rejected documents. What are these documents? Why are these documents not meeting quality standards? Are they missing a translation? Is the English version on the bottom of the packet? These sorts of things can definitely impact our system, especially if we're using machine learning to help scan those documents up front. So we're able to identify if by performance, a vendor number 2, or even within our internal staff may need training. So once it hits that threshold of either 5 or 10%, then we talk about retraining either a group, or we can actually drill down to if it's a specific individual.
Nice. Anything to add there, JP?
Yeah, I'll just add on quickly. I'll just say that, Lila, just spoke to a really good approach there. From a CRO perspective, that's, data that should be able to easily be produced and, meet the sponsors' expectations, because obviously if there's an issue with what the CRO is performing when it comes to a particular area of the TMF or a particular site or whatever it may be, we should be able to break that data down however it's needed in our sponsor requests. So having that flexibility, and like we said, making sure you have a baseline set of metrics established in the TMF plan or maybe elsewhere is really vital.
Love it. So you talked a little bit about the sponsor TMF SOP and TMF plan. I've got a question here from Kirsten. When working with a CRO and maintaining your sponsor portion yourself, is it wise or necessary to work with 2 different SOPs, the sponsor TMF SOP and the CRO TMF SOP?
I want to see why you're shaking your head, Lila.
In this scenario, I think about what would happen in the event of an inspection. And if the sponsor owns the TMF, we have to speak to our SOPs within our system. So I don't think I've ever experienced a scenario where we follow 2 SOPs that's in one eTMF system. So I think the system kind of governs which SOPs are followed as it relates to TMF. If it's a hybrid, then the CRO will follow their SOPs as it relates to their eTMF.
Agreed, 100%. So again, whether we're working in the system that we own internally, I would say that we're following our SOP 99% of the time when it comes to those cases. But when we're working in a sponsor's eTMF or other third-party system, then again, 99% of the time, we're working within the sponsor's procedures and policies that govern that system. Again, trying to follow multiple SOPs, unless it's a really complex trial that includes multiple CROs, multiple third parties and vendors, I think you should try to stick to just the one SOP model.
And then kind of going back to that culture of quality and expectations, this should all be laid out in your TMF plan. So speaking to hybrid scenarios, other repositories, other SOPs, those should all be listed in the TMF plan.
Okay. Along the same sorts of lines, I think there's lots of questions here around the division of responsibilities. And Fran asks, drum roll, what percentage of sponsors are still surprised that the CRO doesn't have all the TMF? Obviously, it's a little bit of a tongue-in-cheek question, but I do think that there is that general perception often that I'm outsourcing to the CRO, so they've got it. They've got the TMF handle. Would you say to that, Lara, as a sponsor? Does that make you shiver a little bit? And or what do you have to say there?
No, I think there is no wrong or right as it relates to who owns the TMF. It's what works best for your company and your business. So, our studies currently that are in our CRO TMF, those are legacy studies. Those were as our company was, smaller, significantly smaller. And as we continue to scale and desire a certain level of oversight, our company made that decision to make it non-negotiable that our CROs are in our TMF. But that's a decision that we made as a company, as a department, based on our experiences and our growth, and our staff, obviously.
Right. And so one of the questions I had was, you talked a lot about archiving at the end of the study, right? And identifying what's the best method. And JP, you recommended against leaving it with the CRO because one, there's a risk component the CRO may not accept, but also there's a risk component on the sponsor side, right? Making sure that you have full control of that TMF. So would you recommend that, smaller sponsors, mid-sized sponsors, even larger sponsors, I would imagine maybe have a system, but are you recommending that these organizations have their own eTMF or TMF systems to hold that TMF at the end of the study? And could it also be used to prepare and collaborate on sponsor level documentation as well during the study? How do you sort of see that play out with sponsor-owned TMF systems?
Yeah, it could be, and you brought up a good point, Oliver. For larger sponsors, it probably isn't an issue because there's probably some sort of internal platform already that supports storage of regulated content, such as the eTMFs. But for a lot of your smaller and maybe mid-sized sponsors, that may not be an option internally. So again, leaving it with the CRO, I don't want you to think that it isn't possible, because it sure could be. But from what I see in my, very recent and, kind of thrown in my face experiences, is that, from a CRO perspective, especially if it's a small or mid-sized sponsor, once that study ends, and again, it brings a certain level of risk to the CRO about what happens in, 6 months or a year from now, when that possibly gets, submitted to the FDA or other regulatory agency, and there is an inspection of the TMF to be performed. So how does the CRO handle that? Are we giving the FDA access to our TMF when technically at that point we're not even, actively within a project for that study anymore? So it just brings up a lot of other questions. And then do we work with the sponsor to provide inspection services, if that's even an option from the CRO? So that's why from, again, the experiences I've been through recently, it really helps to have those discussions early on, and then even as it gets closer to study closeout, to make sure that the sponsor is prepared for life after the TMF is closed in the CRO system and what's going to happen to it next.
Love that. Just to follow on from that, I guess maybe a follow-up question to you, Lila. Obviously, your organization made the decision to bring in your own TMF system, and you talked about sort of it felt right at that point because you had the right team structure, you had the right resources, the right buy-in. Any insight there on when is the right time? When would be the right time for a sponsor to bring in their own TMF system, or is it, really it depends? Is it those questions?
Yeah, that's a great question. And we may not be the only sponsor with this scenario, but we had to rescue a TMF. And that's pretty much all we needed to make the decision, an informed decision, that having our own oversight within our own TMF, with our own staff maintaining the KPIs and monitoring the TMF, that we would never have to rescue a TMF again. We'd rather rescue ourselves, I guess, than have to really, spend a lot of time and effort, resources to rescue TMF and then clean it up. It was probably a year to get the TMF cleaned up after we rescued it. Hard lesson learned, that as JP and I discussed today, having those expectations set up from the beginning with the proactive maintenance would have probably prevented that from happening.
Okay. And then to carry that forward again, there's a theme here. So for you, JP, working in a sponsor's TMF, what are some of the ways that a sponsor can really help their CROs be as efficient as possible and in their own sponsored TMF? If they're not using the CRO TMF, what can they help you prepare for?
Yeah, so I mean, again, just through my own personal experiences working in a sponsor ETMF versus our internal ETMF, I mean, it's honestly really no different. You're processing TMF documents. A 1572 is still a 1572. Obviously, we're going to train on your SOP and receive your internal training on the system, because maybe your ETMF is configured a little differently, or it's a system we may not have as much experience in. But I mean, at the end of the day, we're still doing the same type of work. Documents are getting processed and reviewed. QC reviews are taking place. So again, just setting that up front, like we've talked about throughout the vendor selection, budgeting, and contracting phase, and then straight ahead into TMF plan development, obviously, where that would capture where the activities are taking place. From my personal point of view, it doesn't matter to me whether we're working in the CRO ETMF or the sponsor ETMF. It's still the ETMF.
Love it. All right, guys. Well, we're a little over time, and there's a session that's just began, so I'm going to have to run. But I want to thank you both for such an insightful presentation today, not only because of the knowledge that was shared, but also because we had a little bit of fun. We laughed, we joked, and had a bit of a skit as well. So that was a lot of fun. And the comments in the chat, I don't know if you guys have been seeing them, but everybody loved it as well. So thanks so much, everyone, for joining. I hope you enjoyed the session as much as we did. And we will see you on the next session, which is happening and starting right now, which is getting better sponsor oversight and TMF health insight within eTMF Connect, which is obviously Montreal's eTMF platform. So a real good follow-on from today's session. All right, with that, I'll close it. Thanks so much, everyone, and we'll see you on the next one.
Thanks, everyone.